this one here.
Which of the following microscopic findings is most likely to be observed in this case? Non-caseating granulomas, PAS positive macrophages, transmural inflammation, villus atrophy, or crypt abscesses. A 45-year-old male presents to his primary care physician with a 6-month history of chronic diarrhea, abdominal pain, and weight loss. The patient also reports arthralgia and fatigue. On physical examination, the patient notes enlarged tender lymph nodes. The laboratory test revealed mild anemia and malabsorption. A small biopsy is performed. What of the following microscopic findings is most likely to be observed in this case? Okay, I'm actually not sure here. Just off the go, mild anemia and malabsorption. That makes me think when I think of like anemia, anything with like mild anemia and malabsorption, I'm thinking of like the ileum. I don't know why, just because of like B12 like issues, but they're not really talking about here. I don't really get ulcerative colitis from this. It's a small biopsy that's performed. So I'm gonna get rid of crypt abscesses. I think that's a characterization of of ulcerative. So chronic diarrhea, abdominal pain, and weight loss. Arthralgia and fatigue, enlarged tender lymph nodes, mild anemia, malabsorption. I guess I can say this is Crohn's. I don't really have a great idea if it is or not.
Okay.
I don't see this being like Whippley, which I think that's B.
Okay.
Um, Villus atrophy, I think of celiac disease, and I mean usually they would say like after eating bread or after eating some type of gluten, and then transmural inflammation. What is that? Is that ulcerative or Crohn's? I don't know. I know ulcerative. I mean, I know Crohn's for sure. It does have non-caseating granulomas, and so I'll go
Okay.
with that as my gut answer. I don't
A.
really know.
You're going with A. Sorry, I couldn't hear you.
Yeah, I'll go with A.
All right, perfect. Let's kind of talk to
Mhm.
you about a little bit of here. Okay, so a couple things here. Just based off of kind of your answer choices here, and let's kind of dissect this a little here. So chronic diarrhea, abdominal pain, weight loss, arthralgia and fatigue, physical exam notes, enlarged tender lymph nodes, mild anemia, malabsorption, small bowel biopsies performed, which of the following microscopic findings most likely observed in this case. So then you take a look at the answer, you're like, oh, this is kind of, there's a lot of stuff going on here, right? So you're kind of figuring out what's going on, but okay, one of the key things when you're dealing with these kind of questions is, let's say you think it's a inflammatory bowel disease such as ulcerative colitis or Crohn's. So you got to know those two two diseases contrasted against each other, like very, very, how do I say this? Down, right? You got to get that very, very down and down pat. So, first thing you got to think about, if you think about Crohn's, you think about, okay, you get abscess, the crypt abscesses, you get transmural inflammation, you get non-casing granulomas. So there's three answer choices that support Crohn's, so those can't be right. Does it make sense how I would do?
Cryptapis is with Crohn's as well.
Yeah, non-casing granulomas, transmural inflammation, meaning it's through and through, and then you get these like microcrypt abscesses that can cause fistulas. So those are gonna be Crohn's. Ulcerative colitis is you get those pseudo polyps, right, because of some areas of ulceration, some areas of not. You can get what is it? It's not transmural. You get some inflammation, but it's not full thickness. Right.
Mhm.
You have increased risks of cancers with UC. But yeah, so really you should be getting it down to B and I guess second answer choice and fourth answer choice B and D, right? Because the other three are all Crohn's. So in your mind, you're like, okay, so has to be B and D. And then you have to ask yourself, okay, so what's the most likely here? So celiac disease, right? You can get villus atrophy, as you already kind of know, but also you can get obviously weight loss, chronic diarrhea, abdominal pain. Usually inflammatory bowel disease, you do get some chronic diarrhea, but they usually call it bloody diarrhea, right?
Mhm.
You can get fatigue, right? Arthralgias with celiacs, of course, and then you get mild anemia and malabsorption because most of the time it affects your small bowel, which it has issues with absorbing iron, right? And so that's going to be your main issue there. So this is best probably with villus atrophy with celiacs. So PAS positive macrophages, that's going to be like Whipples. So you're going to have like fatty stools, things like that most of the time, right? But I'm trying to think of is anything else I can tell you. Is crypt abscess UC or Crohn's actually?
I'm pretty sure it was UC.
Okay, you might be right. I forgot. Like, but I remember non-caseating and definitely transmural is
I remember, and I thought that I was between transmural. I was like, I thought that was also Crohn's, but I don't know. And
gotcha,
so, yeah,
gotcha.
transmural inflammation is. I can also check first aid real quick if you want me to check.
Yeah, yeah. Check for me real
All right.
quick. I can't remember. I always like there's always a couple factoids that I forget about UC and Crohn's, but yeah, for the most part, transmural full thickness for sure. And then that's why the fistulas happen. But UC, I think maybe crypt abscesses are for UC, but definitely know those like you got to know those backwards and forwards because if you know them against each other, then those are going to be freebie easy points for your step exam.
Yeah, crypt abscesses is a UC.
Perfect, perfect. Learning and refreshing every day. All right.
Cool.
All right.
Okay,
But does it
cool.
make more sense if that
Yeah,
makes
and obviously you're right. If there's two answers with the same answer, those can't be it. And
exactly.
this in no way pointed to UC. So it had between B and D, and the one that made the most sense, obviously, with like the other extra manifestations, had to be villus atrophy. I mean,
Yeah.
celiac disease, and that's yeah, villus atrophy.
Perfect.